Hello, good day to you. So, as I promised in class, I'll be creating a podcast of today's lecture. So, today's lecture is lecture number 7, and I'm going to look at blood supply to the brain and then briefly look at the spinal cord. Okay, so without wasting time, let's get started with today's lecture. Okay, so basically the aim of the lecture is, as I said, to introduce blood supply circuitry to the brain. So basically I'm going to explain what parts of the brain are receiving blood from different arteries, basically. And then we'll look at the function of the spinal cord. Okay, so I'm going to introduce you basically to the spinal cord. It's not going to be in great detail, but in detail enough that will get you to understand how the spinal cord works. Okay, so with that said, let's start looking at blood supply to the brain. Okay, so basically in terms of blood supply, as you can imagine, the brain needs blood in order to work. Every organ of the body needs blood in order to function. Blood has to do with nutrients, brings nutrients to different organs of the body. So in regard to the brain, there are basically two main arteries that are supplying blood to the brain. There are two carotid arteries and two vertebral arteries, okay, that supply blood to the brain. Okay, I'll look at the carotid artery and then I will briefly look at the vertebral artery. Okay, so in terms of the carotid artery, there are two kinds of arteries. There's the right common carotid artery, and then if there's a right common artery, there is possibly a left common artery as well. Okay, so in terms of the carotid artery, there's a right common carotid artery, then there's a left common carotid artery. Let me show you basically what this looks like on in terms of blood supply from the heart. Okay, so this is what blood supply basically looks like from the center or from the source of the heart. There's a whole theory on how blood is made, and I'm not going to go into all that, but if you're interested, there is quite a lot of information as to how blood is created in the body. But basically, you have blood that is being pumped from the heart, and it is passed through the common carotid artery. You can see there's the right common carotid artery, which is that artery there. And then you also have the left common carotid artery. Okay, so basically these are the main carotid artery, the right and the left common carotid artery. You can see it's quite a very complicated blood system, but we're only going to look at the carotid arteries and the vertebral arteries. Okay, the vertebral arteries. So again, there is a right and a left vertebral artery. Again, if you go back to the imagery, you can see the right vertebral artery. There should be another left vertebral artery here, but you can't, obviously. This is a diagram, and not everything will be in the diagram. So there is a right vertebral artery, and then there's a left vertebral artery which is not indicated here. Okay. So now these main arteries, basically they start to branch out. Okay, so these principal arteries, the carotids and the vertebral artery, connect at the base of the brain. Okay, so they connect basically at the ventral aspect of the brain, and then they branch out into different parts of the brain. There's three main cerebral arteries. There's the anterior cerebral artery. Okay, again, you will remember we looked at these different definitions. Anterior means something that is in front. Okay, so the anterior cerebral artery branches to the front side of the brain, and it supplies basically different brain areas within the front of the brain. For example, it supplies the frontal lobes. The frontal lobes are the lobes here in front with blood. It also supplies the anterior corpus callosum, okay, anterior part of the corpus callosum with blood. Remember, the corpus callosum is this middle section here. Okay, so it supplies the corpus callosum with blood. It also supplies the parietal lobes with blood. Okay, so basically you have your parietal lobes there. It also supplies the parietal lobes with blood. Okay, so that's the anterior cerebral artery. And then the middle cerebral artery, again, it's in the middle, it's in the midline of the brain. Okay, hence it's called the middle cerebral artery. It provides blood basically to the temporal lobes. Okay, your temporal lobes would be these lobes here, close to the temples. And it also supplies blood to the basal ganglia. Okay, you won't be able to see it from this, but it supplies blood to the basal ganglia as well. And then the posterior cerebral artery. Okay, the posterior cerebral artery is the branch of blood in that section. And posterior means at the back of or behind something. Okay, so the posterior cerebral artery is supplying blood to the back of the brain. Okay, so mainly to the occipital lobes and some parts of the brainstem. Okay, this area here will be some parts of the brainstem. Okay, things like the pons, things like the medulla will receive blood from the posterior cerebral artery. Okay, so basically, with all this blood going on, there will be some problems. As everything in life, there are some problems in terms of blood supply. And the main problem in terms of blood supply is something called stroke. Okay, so basically you can have stroke, and strokes basically are called cerebrovascular accidents. Cerebral has to do with cerebral, and cerebral has to do with something in the brain. Okay, so it's a vascular accident in the brain. The term vascular has to deal with anything to do with blood is referred to as vascular. So cerebrovascular accident is a blood accident in the brain. Okay, basically in layman's terms, that's what it is. And there are mainly two types of strokes. Okay, there's an ischemic stroke as well as a hemorrhagic stroke. Okay, I'm just going to look at mainly the ischemic stroke. I'm not going to look in great detail in hemorrhagic strokes, but by definition, ischemic strokes, basically there is lack of oxygen. So basically oxygen is deprived to the brain and is often the result of a clot. Okay, you can see in this animation here, sort of in this diagram, there is a clot. So basically blood is not flowing to where it needs to flow. And different parts of the brain basically become ischemic. Okay, they don't receive blood. So in other words, this artery here has to be supplying blood to the rest of the brain. However, if there's a clot, you can see the blood cannot go to where it needs to go. Okay, so it leads to what is called an ischemic stroke. Okay, so basically it's a stroke resulting from oxygen deprivation. And then you have a hemorrhagic stroke. Okay, the term hemorrhage means bleeding. So there is basically you can have a hemorrhage when the blood is not controlled and it bleeds to different tissues within the brain. Okay, so basically an example of this would be sort of in this diagram. So you've got an artery that is bringing in blood. However, you got a whole base of blood here, whereby this blood basically has bled. It has spread out in an uncontrolled way. Okay, it leads basically to what is called a hemorrhagic stroke. Okay, hemorrhage is a bleeding. Okay, so let me just further explain or define in simple details what is an ischemic stroke. Okay, from this beautifully designed diagram, you can see there is very nice flow of blood. Okay, this blood is basically coming from the cerebral artery as well as the ventral artery. Okay, the common carotid artery and the common vertebral artery. Okay, so you have blood that is coming in, and some of it moves to the anterior part, some of it moves to the middle part, some of it moves to the posterior section. So in a normal carotid artery, you can see there's a very nice flow of blood. Looks very nice and rich. And then you have some sections that are diseased carotid arteries. So in this section, there's basically a blood clot, and then blood is not flowing out, and blood does not reach where it needs to reach. Okay, this causes a stroke. So by definition, Ischemia is insufficient blood supply to an organ. Okay, an organ can be basically like the heart or anything of that sort. In our case, we're looking at the brain. Okay, so it's insufficient blood supply to the brain, usually the result of a blocked artery. Okay, so you can have an artery that is blocked, and this leads to a stroke. Again, as we mentioned in class, the right side of the body, of the brain rather, controls the left side of the body and vice versa. So if there's a stroke on the left hemisphere, it's gonna show itself in the right side of the body. Okay, so you have a stroke, let's say on the frontal part, the left frontal side of your brain, the effects are gonna be on the right side of your body and the other way around. Okay, so remember the axons decussate. So basically they cross from one side to the other side. So if there's a stroke on one side, you will feel the effects on the opposite side. Okay. So that's what happens basically in strokes in a nutshell, and there is a treatment for strokes. Okay, it's not doom and gloom. There is a way of treating ischemic stroke. Okay, and this has to be done at least 3 to 4 hours after the stroke has happened. So there is medication to treat strokes, and I'm going to introduce you to the medication that is often used in hospitals to treat for ischemic stroke. So basically what the medication tries to do is to restore blood flow to the brain as soon as possible. Okay, so what the medication does really is it's meant to dissolve the clot, and it's meant to get the blood flowing once again. Okay, so the aim is to restore blood flow to the brain as soon as this thing is possible. If it's not treated immediately, it's going to result in all sorts of deprivation of oxygen and blood to different parts of the brain. So you want to treat your clot as soon as it is humanly possible, at least 3 to 4 hours when the stroke occurs. So in the hospital, they use basically something called the tissue plasminogen activator. Plasminogen basically is a type of protein that is involved in breaking down a blood clot. It's a very, very complicated kind of protein. So very often it's injected into the arm, and it travels to the blood clot, and it starts to break down the blood clot. So the blood clot literally breaks down so that blood can start flowing to where it needs to. In normal circumstances, a clot is actually quite good. It's a good thing. So imagine you're bleeding. The body is going to automatically create a clot to stop the bleeding. However, in some circumstances, the clot can be quite disastrous. So imagine you have a clot on the brain and blood is not flowing. You don't want that to happen. So TPA basically dissolves the clot so that blood can resume its flow in the central nervous system. Okay. So more or less, that's the way you treat ischemic stroke. Tissue plasminogen activator is a type of protein that breaks down clot so that it allows blood to flow once again. Okay, with that being said, that's a very, very brief summary of the blood supply to the nervous system. You basically have a situation whereby there are two principal arteries. There's a carotid artery, and then there are vertebral arteries. These arteries meet at the base of the brain, and then they dissolve further into the anterior cerebral artery, the middle cerebral artery, and lastly the posterior cerebral artery. The anterior cerebral artery supplies blood to the anterior portions of the brain, that is the front portions of the brain, okay, so mainly the frontal lobes. And then the middle cerebral artery supplies blood to the temporal lobes as well as the basal ganglia. And then the posterior cerebral artery supplies blood to the posterior sections of the brain, mainly the occipital lobes and parts of the brainstem. So with that being said, I'm going to start looking very, very briefly at spinal cords and the function of the spinal cords. This will be the last basic introduction to the central nervous system. Then once we're done with these building blocks, we're going to start looking at other activities of the central nervous system. So let's look at the spinal cord and the basic function of a spinal cord. So basically all vertebrates have a spinal cord and it controls body movement. Okay, most of the body movement is controlled by the spinal cord. We also looked at the cerebellum. The cerebellum also has to do with body movement, and we briefly looked at the frontal lobes. The frontal lobes also have to deal with body movement. However, the spinal cord controls most of the body movement. The spinal cord it's very delicate, and it contains basically 30 spinal cord segments or 13 nerves that are divided into 4 main regions. I'm going to expand, or rather I'm going to present these regions so that you know about them and sort of make sense of them. The first region is called the cervical region. It has 8 main nerves that are supplying basically ability to the cervical segment of the spinal cord. And then secondly, you have the thoracic segment, which contains 12 nerves. You have the lumbar segment, and then lastly, you have the sacral segment, which has 5 main nerves. Okay, so these are the main nerves that supply the spinal cord and have to do with movement. Okay, so they control most bodily movements. So what I'm going to do in the next slide is I'm going to show you a very nice diagram that sort of shows you the different nerves in the vertebrae. Okay, so there is the diagram. Okay, you can see there the C1, C2 all the way to C8, that would be your cervical nerves, and then your T1 to the T12 would be your thoracic nerves, and then L1 to L5 would be the lumbar nerves, and S1 to S5 is your sacral nerves. So what happens in most accidents, you can imagine you are in a car accident. Let's hope that doesn't happen to any one of us. But you can imagine you're a patient who has been in a car accident and you have, for instance, a spinal cord injury in the lumbar nerves. It's extremely, it's a very delicate area. Once the patients have spinal cord injuries right here, it leads to all sorts of troubles. There have been some patients who have done horse riding and they have fallen and part of the thoracic nerve has been affected and it leads to permanent disabilities in walking and so forth. So the spinal nerve is quite delicate. Again, there's a very nice video at the end of the lecture that shows how the spinal nerve basically functions. Okay, so basically you have the cervical nerves, the thoracic nerves, the lumbar nerves, and lastly the sacral nerves. You also have this section here called the coccygeal segment. It's this segment here. It also forms part of the spinal cord. However, in most textbooks, it's not really part of the 4 nerves that I explained to you. In some textbooks, they talk of 5 segments of the spinal cord. Some talk about 4 segments of the spinal cord. But the coccygeal segment is part of the spinal cord. Okay, so I just want to expand a bit further on the spinal cord. The spinal cord basically has 2 main roots. There's the dorsal roots as well as the ventral roots. Okay, so the term dorsal, you remember, means something that is on top or something that is superior. Okay, it's above something. Then ventral is something that is below something or is inferior to something. Okay, so the spinal cord has the dorsal roots as well as ventral roots. I'm going to explain these roots and basically explain what is in each of these segments. Okay, so let's look at the dorsal roots. So the dorsal roots is a strand of afferent fibers that are entering the spinal cord. Okay, so basically it's fibers that are coming into the spinal cord. The term afferent means something that moves towards the center. So it's something moving from somewhere and it's moving towards the center of something. That's what the word afferent means. Rather afferent. So it moves towards the center. So what this root does, the dorsal root, is that it carries sensory information to the brain. Okay, so it has to do with sensation. So you have afferent roots carrying information, mainly sensory information, all your five senses into the brain. Okay, that is all done within the spinal cord and particularly the dorsal roots of the spinal cord. Again, I'm going to show a diagram to sort of show what the sensory, the dorsal root looks like that carries sensory information. Okay, so here is our diagram. So you can see from the first explanation, you have dorsal roots which are carrying sensory information. You remember from the first lecture, I explained that there are two kinds of neurons. There is a sensory neuron and then there is a motor neuron. Sensory neurons basically carry senses, all your five senses, and they have to do with sensory information. So dorsal roots carry sensory neurons into the center towards the spinal cord. Okay. And when this information gets to the spinal cord, you can see some of it moves to the other side, moves across, and it starts to influence motor neurons. Okay, so sensory information comes in, and then you can either continue there or you can desiccate, can cross to the other side and start influencing basically your motor neurons. Okay. So sensation and motor do interact at some point. Okay, it's not exclusive to one another. That's sensory information. And then in terms of the ventral roots, the ventral roots is a root of strands. Okay, it's a strands of fibers that carry efferent fibers. Okay, efferent fibers that are leaving the spinal cord. So it's a strand of efferent fibers leaving the spinal cord. This is opposed to afferent, which are moving towards the spinal cord. Okay. So efferent means away from the center. Okay, it's opposite to afferent. Afferent is towards the center. Efferent is moving away from the center of something. So these kinds of roots carry basically motor information to the body. So information comes in via sensory. It moves towards the center of the spine, and that information then moves via the motor or ventral roots. So the ventral roots carries motor information to the body. Okay, so in terms of movement and moving your legs, moving your arms, you name it, it's all part of the motor on the ventral segment of the spinal cord. Okay, so again, going back to this diagram, you can see that the motor neuron is moving away. Okay, you can see that it's moving away from the center of the spinal cord. Okay, so fibers leaving the ventral roots carry motor information to the muscles. Okay, that have to do with movement. So you got the dorsal roots, then you got motor roots, and then there's collateral movement of the sensory roots, and then basically you also have white matter. So again, you remember white matter is a collection of myelin, and myelin carries information to and from the brain. Myelin coverings are extremely important. Without these coverings, there won't be information that will be able to flow freely within the spinal cord or within the central nervous system. So myelin is quite important to flowing of information. So I want to introduce you to some very, very intelligent gentlemen who discovered really this dorsal and ventral roots of the nervous system. These two gentlemen, as you can see, are very, very intelligent, and they had a fight as to who really owned or who discovered this dorsal and ventral information in the spinal cord, they were such enemies. You can see they're looking at each other in, oh well, they're not looking at each other, but they're looking at you and me in very like, these two gentlemen fought and said, oh well, I discovered this thing. Then the other one says, no, 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 I discovered this thing. Basically, to come to a compromise, these two gentlemen, Sir Charles Bell and Francois Mangendi, developed what is called the Bell-Mangendi law. Well, they didn't develop it, but people came to sort of an agreement to say, let's acknowledge both these guys as at least discovering this ventral and dorsal ability in the spinal cord. So the Bell-Mangendi law is named after Charles Bell and Francois Mangendi. And what the law basically is this. Dorsal roots only contain sensory nerves and ventral roots only contain motor nerves. Okay, so it's a law. You can't have dorsal roots doing motor nerves. Neither can you have ventral roots doing sensory nerves. It's a particular thing that was discovered by Bell. Well, it was came to a compromise between Bell and Mangendi. Okay, hence it's called the Bell-Mangendi law. Dorsal roots only contain sensory nerves and ventral roots only contain motor nerves. That's what the Bell-Mangendi law, okay, is all about. And it just looks at the spinal cord. Who knows, maybe one day you might discover something and name it after yourself. You know? Imagine like the Caesar-Zondo law. Oh, that'd be quite cute. Or imagine the Rudo Tafadzwa law. You can have something of that sort. Anyway, that's the Bell-Mangendi law. It looks at the dorsal roots and information related to the dorsal roots, and then the ventral roots and motor activity. So what I'm going to do now is I'm going to show you a very, very nice video on the spinal cord, and it sort of summarizes some of the stuff that I've said, and it also introduces you to some new information. It's a very, very nice video that is, at least you get to see what the dorsal root looks like, and then you also get to see what the ventral root looks like. So I'll play the video in the next slide. However, on Monday, I think it would be nice for us to summarize a few issues related to what we have studied so far. So on Monday, what we're going to do in class is that we will do a few multiple choice questions, plus minus 20 questions that we can sort of summarize the section that we've looked at. And I will introduce you to some very nice software on Monday that will help us at least answer some basic questions that you should be able to either answer or not. But it's very nice for us to just take a breather. So on Monday we'll take a breather and we'll do some MCQ questions in class, and I'll also show you another documentary that summarizes the central nervous system. So Monday will be a chilled lecture that summarizes, basically it's almost like a sort of a test to see how much information we have we've both learned during this time. So without wasting time, let me show you the video on the spinal cord. And it basically summarizes some of the things that we have been looking at.
I have an opportunity today to show you an example of a spinal cord that has just been removed from an autopsy case. This is a normal spinal cord. Let's review for a moment the spinal column on this model, which is a little bit twisted, but that's okay. Here is the posterior or dorsal surface with the spinous processes. So let me move this out of the way and show you the spinal cord. The main thing I want to stress to you is how small and how delicate the spinal cord is. Notice its diameter. It's smaller than the diameter of my little finger. And if I come down here and make a cross section at the cervical region, right here at the top of the cord, I can show you that this tissue is totally soft. It's as soft as a piece of gelatin. And so you can imagine if there was a subluxation. Subluxation is when the spinal column suddenly, with trauma, goes one way or another, and the disc or the bone can temporarily compress the green spinal cord that is within it. It just takes a moment to cause, you can imagine, a jerk on the cord and to leave a patient with paralysis. This is very, very soft tissue and very vulnerable. So let's examine the cord now. Let's look up close. I'm looking now at the posterior or dorsal surface, and I can see, and I hope you can, between the forceps are the dorsal or posterior columns with branches of the posterior spinal arteries running along the surface. And if I turn it over, I can see the anterior surface with its single spinal artery. This spinal artery is very important because it provides blood to the gray matter of the anterior horn, to the cortical spinal tract as it descends in the cord, and to the pain and temperature pathway. Whereas the posterior spinal artery, as you might imagine, supplies one or the other of the two dorsal columns carrying proprioception. So damage to the anterior spinal artery, or nothing more than hypoxia during a surgical intervention, let's say to replace a section of aorta, can leave this anterior spinal artery without enough oxygen or blood to supply the cord, and the patient will remain without control of motor function below that level and with loss of pain and temperature traveling in the lateral regions. So now I'm going to open the dura for you. The arachnoid is adherent to the dura, so we're going to look down, as we have been, onto the pia, or the pial surface. Down here, near the cauda equina, we can see the dorsal and the ventral roots, and I'll open the dural sac in just a moment. Here is a dorsal root ganglion on this side. Here is the stub of one on this side. Here is another one on this side. The dorsal and ventral roots are emerging here. Now we're looking at the cauda equina and the tip of the spinal cord. Here's the conus medullaris, and here are the elongated dorsal and ventral roots, and you can see that they are running to emerge. Here would be at one spinal level, probably a lumbar, and here is another one here. If you zoom in close, you can see the roots. Here's one group of roots emerging. Up here is another group of roots emerging. And in between you can see a thin membrane here, the denticulate ligament that anchors the cord laterally and separates anterior or ventral from posterior, which you can't see from this side of the spinal cord. It's good to point out that the cauda equina, these represent both dorsal and ventral roots. Therefore, they are sensory and motor. They have emerged from the spinal cord and therefore are ensheathed in Schwann cells. These are peripheral nerves, so to speak. That is to say, if they were compressed or damaged, but not separated between proximal and distal end, they could regenerate. So damage to the cauda equina roots gives you the option or the possibility or the potential that these axons can regenerate down through the Schwann cell tubes that are left behind. Whereas damage to the cord at this point, with our knowledge, is basically irreversible, but sometimes some of the pain and temperature fibers are spared along the edges.
Okay, that's about it. Okay, so that's it for today. That is a basic end of the lecture, and we've looked at blood supply and the function of the spinal cord. I hope you found this helpful, and be very patient with some legs in there. But I hope you found it helpful, and please let me know on Monday what you thought of the podcast, and if it's a good way to go about teaching and learning. So with that, wish you a very very good day, and enjoy your weekend. Au revoir, goodbye, cheerio, cheers, bye.